contagious caprine pleuropneumonia. In Rajasthan, I have not seen this infection much. And in field also, there are very less cases of Ccpp. This infection is caused by Mycoplasma capricolum subspecies Capri pneumoniae. The morbidity is 100%, and sometimes mortality goes very high. It is 80 to 100%. And it is widely prevalent in around 40 countries, and in India, it is also prevalent. First, this disease reported in Algeria, and it is also called as Bovfrida. The disease spread by direct contact and aerosol routes. There are three forms of the disease. One is per acute form, second is acute form, and the third is chronic form. In per acute form, there is a sudden death within 24 to 72 hours, and clinical symptoms are absent. There is no clinical symptoms. But in acute form and chronic form, you will get these respiratory symptoms and other clinical signs. The clinical symptoms are anorexia, depression, dyspnea, fever, coughing, nasal discharge, lagging behind, lying down, and thoracic pain are also reported. And other signs include inspiratory dyspnea accompanied by grunting sound and snoring sound. In some reports, they have given the clinical symptoms as continuous nasal discharge, which is initially serofibrous, straw colored, followed by thick mucoid or purulent and rust colored might be observed. Here you can see these are downloaded from internet. So here you can see the severe nasal discharge. Then this pleura is thickened, and always there is unilateral consolidation of the lungs. So this one side lung is not affected, but other side is heavily affected, enlarged with thickened pleura, and on the cut surface can find the typical picture like marbling. Then in microscopic lesions, you will find septal peribronchial fibrosis in 82%, fibrinous pleuritis in 64%, then peribronchial cuffing of inflammatory mononuclear cells 55%, and in the pneumonia, the macrophages are the main cells, followed by neutrophils, along with few pulmonary fibrin deposits. Then this pneumonia is typically bronchointestinal pneumonia with emphysema and atelectasis of alveoli, then thickening of interlobular septa, then proteinous material deposition in alveoli, which is characteristic of Ccpp. Here you can see the proteinaceous material. This is characteristic of Ccpp. So thickened interlobular septa and a lot of inflammatory cells are there. Then diagnosis of this disease can be done by clinical science, gross and histopathology. You can isolate organism, but the isolation is very difficult because this is a somewhat fastidious organism and require special growth media, and special facility should be there for isolation of mycoplasma. So somewhat difficult to isolate, but this is gold standard method to confirm the disease. But you can diagnose this disease by ELISA, FAT, CFT, and indirect heme agglutination test. Nowadays, this PCR test is very popular, and C-ELISA is also popular.